Well, public health nurse requires a bachelor's degree in nursing and a public health nurse certificate. So first step is to get your bachelor's degree in nursing, and then you can apply for the public health nursing certificate. In order to get a public health nursing certificate, your program that you're getting your bachelor's degree from must offer the community health 90 hours. Basically, you're going to go out and decide what public health issue you see that you want to try and address, and you have 90 hours to address it, to write a paper telling about why you chose this, why you think it's a big public health issue, and what your plans are or what suggestions you have on alleviating that problem or helping to alleviate that problem. That's 90 hours. You have to have a sponsor. So it could be, let's say, a senior center if you're working on a public health problem that's involves seniors. It could be a rural health clinic. So there's a lot of options, but you get to choose what you're going to do that's under the public health umbrella, and then you have to do the hours, which require a lot of different things: interviews, a windshield observation of the community you're going to be working in, and just a general overseeing the community, and then being specific to your problem that you're addressing. Then that will get you a certificate after you graduate, and all that paperwork goes into the Board of Nursing here in California, and they'll gladly give you your nursing license and a nice public health certificate all at the same time. If you're already an RN and you want to go back to school and get your bachelor's degree, then the programs that are out there, there's quite a few. Many of them are online. So you just need to make sure that they offer the public health portion so that you can get your certificate, because not all of the online programs offer that. And without the public health nurse certificate, you are unable to apply for a public health nurse job in any of the counties in California. How I got there was years of working both in the hospital, some clinic work. I worked in the prison system. I worked in the jails. Obviously, I worked in multiple departments in the hospital. And I was just getting burnt out. I just felt like there was something missing. And as I was working on my bachelor's degree and doing my public health 90 hours, I thought, wow, I really like this. This is preventative medicine, basically. You're out there trying to educate the public, help a client to get resources, to stay independent, or to get medical services or social services or whatever it is that they need. You're connecting them. You're like a broker of services. You don't actually provide the service, because as a public health nurse, you don't do hands-on, but you're a broker. You know all the resources in your community, or you know people who know them, and you connect your client, your patient, with those resources to support them so that they can be healthy mentally and physically and socially and environmentally in your community. And therefore, that's good for the whole community, because then people aren't worrying about them. They're not utilizing emergency services frequently anymore. They have food. There's so many resources. I could go on forever with the amount of resources you could connect people with, but that's an important thing to know, that's what grabbed me. And all I can say is that if it hadn't grabbed me, I think I would have gone into another field and retired from nursing, because I was pretty physically tired. And this is a wonderful thing. You get to know your community so well, and you get to know all of the resources. You get to know a lot of law enforcement, and that's a resource. People think of them as not a resource, but they're a great resource. You get to know the fire department well, all the other services within your own county. So there is a huge benefit to connecting as a public health nurse.